Hi, welcome to this video. I'm Dr. Shabnam Das Kar, and I'm a consultant in functional and metabolic medicine. Today, I will talk about PCOS and one particular aspect of PCOS, which is extremely important. The title is PCOS, Should You Stop Using Plastic Bottles? Now, many of you, if you know what I'm talking about, you know where this is going. But if you don't know what connection plastic bottles have with PCOS, you'll probably be more enlightened at the end of this video. So I'll share a PowerPoint. And PCOS is extremely common all over the world, and particularly in countries like India, it is, okay, sorry, here I am. So should you stop using plastic bottles? Now, why am I saying that? So what do plastic bottles contain that is so harmful? So plastic bottles contain substances like bisphenol A, BPA. Many of you have probably heard of BPA, and it contains things like phthalates and dioxins, which are considered to be endocrine disrupting chemicals. So endocrine basically meaning hormone disrupting chemicals. So what are endocrine disrupting chemicals, or EDCs? They are exogenous substances or mixtures that alter function or functions of the endocrine system and consequently cause adverse effects in an intact organism or its progeny or subpopulations. So that's the very sciencey version. So put in simple terms, exogenous, that means these are not products and substances that are produced by your body. So your body is exposed to them from the outside. So they could be single substances or they could be a mixture of different substances. And the endocrine system is the hormonal system. And consequently, they cause adverse effects in an intact organism. Now, it could be animals and humans as well. And EDCs also have the potential to affect the newborn babies in animals as well as in humans. Now, those of you who know what PCOS is, obviously you know what I'm talking about. But for those who are not very familiar with what polycystic ovaries are, so polycystic ovaries, or PCOS or PCOD, it's known by different names, is a very complex condition and one of the commonest hormonal abnormalities in women. And incidentally, it occurs in all ages. So some of you may have experienced it from a very young age. You were diagnosed with PCOS when you were probably an adolescent. You had just started your cycles and you were missing a few cycles. You had started gaining weight and you went through an ultrasound examination and you were detected with polycystic ovaries. However, in the very young girls, just having a polycystic ovary and irregular cycles only on ultrasound, just showing polycystic ovaries, will not be adequate for a diagnosis of polycystic ovaries. You also need to have higher levels of male hormones, or in medical terms, hypoandrogenemia. And you could even be having some features of high male hormones, which can manifest as extra hair. Now, some of these features are sort of an overlap, but without going into all the details of diagnosis, because obviously your doctor would know how to diagnose, I just want to stress upon the fact that only having polycystic ovaries on an ultrasound examination, you may have had the ultrasound for any other reason as well, is not enough for a diagnosis. And in a little older women, it may be that, again, the same problems of obesity, irregular cycles, and some women may have problems of infertility, not being able to get pregnant easily. So it may be discovered in many different ways. The commonest presentation is usually with irregular cycles. Again, it depends on which part of the world you are in. For women who are in the Western world, like countries like Canada and the US, a lot of women do not have a lot of extra body weight. But when the blood tests are done, and I'll just briefly explain what blood tests we would do, it would show that you have metabolic dysfunction and you may have extra male hormone levels. Versus in countries like India, usually the commonest presentation is with extra body weight, irregular cycles, and something called, you get a sort of a blackish discoloration of the neck area at the back, which we call acanthosis nigricans. You don't need to know the difficult words, but the basic underlying problem in PCOS, irrespective of what age it is detected at, is something called insulin resistance. So insulin resistance is a problem where the hormone insulin in your body doesn't function as well. Now, you know that insulin is very important for blood sugar levels. However, though the basic underlying problem in polycystic ovaries is insulin resistance, in the diagnosis of polycystic ovaries, insulin resistance is not considered to be a criteria. Now, that is not very relevant for you if you're a patient, but it is relevant for you in management. Versus in the medical world, we always talk about, what are the different features? How does it fit the picture of polycystic ovaries? So different age, different problems. And even in after the menopause, also women with polycystic ovaries do continue to have certain problems. Again, what those problems are, I'll discuss on another video. However, the highly simplified, obviously this is extremely complex. It is an interaction of your genes, of the environment. And why is it that polycystic ovaries have become much more commoner today than when, so I was an OBGY many years ago. And when I was in med school, we did not see as many polycystic ovary disease patients versus what we are seeing today. So why has the incidence gone up so much? Though we don't know the exact reasons, one of the clues could be hormone disrupting chemicals. Of course, that is not the only reason. Some of the environmental influences may even start in your mother's uterus before you were born, when your mother was pregnant with you. So it is extremely complex, but few things are important. Number one, weight loss will impact everything else. So weight loss will, reduce your high levels of male hormones. Weight loss will reduce your insulin resistance. Some of you have high blood pressure along with polycystic ovaries. Weight loss will reduce your blood pressure. So all those benefits that come with, treatment of polycystic ovaries, weight loss will impact all of them. However, one of the biggest challenges that women all over the world, and particularly in countries where they show up as excess body weight, all of you have experienced this challenge where you may have lost weight for some time, but very often all the weight comes back, and sometimes it has even happened that you end up gaining more weight than you started off with. And this is like that roller coaster journey, extremely frustrating. And what are the solutions for that? On 11th of July, we have scheduled a free webinar. So at the end of the video, I'm going to post the link for the registration. It's a free webinar, and I will go into deeper, a little more information about what you can do and why is weight loss such a challenge. So going back to hormone disrupting chemicals and why you should ditch your plastic bottles. So what are endocrine disrupting chemicals? Now, EDCs are so harmful that the Endocrine Society, which is a world organization of thousands of endocrinologists all over the world, and even the World Health Organization has a document about the problems of endocrine disrupting chemicals. So the problem is widespread, it is huge, and EDCs can harm actually almost every organ in your body. PCOS, thyroid are the commonest ones, and some of you have PCOS along with hypothyroidism or Hashimoto's. So that is not a coincidence. There are reasons because of which they are often present together. Now, unfortunately, some of the harmful effects may start in the womb even before you are born. So we've had women born with, when they tested the cord blood, so that is the cord that connects the baby to the mother in the uterus, they checked for these hormone disrupting chemicals in the cord blood, and many of these babies had very high levels. So obviously the baby had got it from the mother, and the mother was exposed to these chemicals over a period of time, and obviously they accumulated. Now, some of these EDCs are called obesogens. So obesogen means that they impact obesity. So they make people gain weight. and they make people retain the fat. So it's not just gaining weight in terms of muscle or your bones, it is fat percentage which goes up. So these are substances called obesogens. And unfortunately, some of these EDCs, these chemicals, are harmful even at very low dose. And the other important thing to remember is, if you're reading literature, that very often the tests are done only on individual chemicals. However, when you are exposed to them, you usually get a soup of them. And you will find out where the source of all these endocrine disrupting chemicals are coming from. And that is where you'll understand why I'm talking about being exposed to a whole host of them together. So on the basis of a lot of animal studies and human studies as well, uh, endocrinologists, that means hormone doctors all over the world, and a lot of pediatric endocrinologists have expressed a lot of concern about hormone disrupting chemicals. And some of these chemicals have even been called forever chemicals. That means they never get degraded in the atmosphere. So what are some of the harmful effects of EDCs? You can see that long list. And for those of you who would like to get into the sciencey details, I know there are some doctors also in the audience who like to understand the mechanistic way, like why does this happen? I would recommend that you read this particular article of 2016. So these are the harmful effects: obesity, metabolic disorders, infertility, hormone imbalance, diabetes, hormone-dependent cancers. And do you notice that these are also conditions which are not prostate cancer, but these are also conditions which are common with PCOS. Obesity is present, metabolic disorders, infertility, obviously hormonal imbalance, and people with PCOS are at a much higher risk for diabetes, heart disease, and that whole plethora of diseases, and hormone-dependent cancers like cancer of the uterus. Not so much the breast and PCOS, but uterine cancer, there is a higher risk because you get more estrogen and not enough progesterone. So that's the reason many of you have missed your cycles. You do not get your cycles every month. That is one of the commonest problems of PCOS. So hormone disrupting chemicals have been associated with all these conditions, and many of these are common to PCOS as well. So where will you find EDCs? Obviously you're wondering, other than plastic bottles, is there anywhere else you'll find them? Yes, they are practically everywhere in your world. So plastic bottles, pesticides, non-stick pans, particularly the older ones. So all these soda cans or any other can, all of them have a lining of, many of them have a lining of something called BPA, that is bisphenol A. Plastic toys that sometimes babies, they suck and chew on them. Then cosmetics, skincare, that is a huge exposure because your skin is a huge area and you're applying on your skin, you're applying on your body, on the face. Some of these are color cosmetics, some of them may be your other skincare cosmetics. So I will briefly discuss on what you can do about them, but before that I'll just finish up with what is happening with PCOS. So again, these are different names of the multiple endocrine disrupting chemicals that are present. You can see where they are. Even things like electronics, building materials, car seats, then plastic and food storage materials, personal care products, medical tubing, those IV lines and they have a tube, that contains plastic as well. Sunscreen, triclosan is something that is there in antibacterial soaps. So antibacterial soaps are not really necessary, and particularly given this time of COVID-19. Most of you, I hope, are washing your hands more often. So you don't necessarily need an antibacterial soap. Just a regular soap is good enough. Then there are the perfluorochemicals, then persistent organic pollutants. So they are extensive. They are everywhere. The most important thing is for you to know where they are and how can you reduce your exposure to them. So now this is a very interesting paper. So they looked at PCOS and endocrine disrupting chemicals. So this is a paper from Greece. So they looked at, so what did they do? So in the paper, they looked at 71 women with PCOS and they compared these women with another equal number of women of similar age and weight who did not have PCOS. And this was in Greece. So the women who had PCOS, some of them were obese, some of them were lean as well. So blood levels of bisphenol A in women with PCOS was higher than in women without PCOS. And interestingly, the higher the levels of BPA, the higher the levels of androgens, the main hormones like testosterone and DHEA, and worse was the insulin resistance. So obviously, the higher the levels of BPA, number one, the PCOS women had more BPA in their blood. And not only that, those with the higher levels of BPA also had higher levels of male hormones and worse insulin resistance. So this is extremely important because these are probably areas that we can, control. And again, I'm not saying that, only taking control of your hormone disrupting chemical exposure will be enough to treat your PCOS. PCOS is not as simple, obviously. Otherwise, you would have treated it a long time ago, right? So, but this is one of the factors that is often not considered because, not everyone may be aware of EDCs. So what can you do? Obviously, you're interested in knowing what can you do to reduce your exposure. Number one is, ewg.org is a very good website for you to check where you can get most of your EDC exposure from. The Endocrine Society has a website which is for the public. It is called hormones.org. You can go there, and there are a lot of documents for the public. So first, now if you know that most of your EDC exposure is coming from things like plastic bottles, plastic food containers, cans, and all those plastic usage in packagings and things like that, obviously it makes sense for you to reduce exposure. Now, can you get rid of plastics completely? Well, the thing is, there's no harm in trying. I must say that when I'm traveling, sometimes I do have to buy mineral water because I may have run out of water. Then I do drink from a plastic bottle. And sometimes my friends will tease me, how come you are carrying a plastic bottle? I said, obviously my thirst overtook me. But in airports nowadays, that many airports have a drinking water fountain, so you can carry your own bottle and fill it up there. If you are traveling around commuting in a car, even more important that you don't use plastic bottles which get baked in the sun, and then that causes release of a whole lot of these hormone disrupting chemicals. So some of these hormone disrupting chemicals are what we call hormone mimickers. So structurally they may be similar to your hormone estrogen. Some of them may impact the liver and how it metabolizes your hormones testosterone. So EDCs affect women as well as men. So men are not immune to it. And can you imagine if as a man you get an extra dose of the female hormones? So some of the EDCs are estrogen mimickers. So they look like estrogen to the body structurally. So the body thinks that instead of the normal estrogen, they should bind with this harmful estrogen, which is a synthetic harmful chemical. So what can you do? So these are the ways to reduce your exposure. So check out all the resources on ewg.org. Find out what are the food which have a much higher percentage of pesticides versus the ones that don't have as much. Some of the fruits and vegetables, you can probably wash them very well. That can also get rid of some of the pesticides. Obviously, eating organic, if that is an option for you, would definitely make a difference. And there are studies supporting that eating organic would reduce your pesticide burden, because obviously a lot of it comes from the food themselves. But obviously there are areas which need action at a community level, at the government level, things like, where are people dumping toxic waste? So that can go into the groundwater, and you are drinking that groundwater. Even if you purify it quite a lot, you cannot get rid of everything from the water. Even the best purification system will not be able to detect all of them as well. So the goal is to reduce your personal exposure versus, worry about all the environmental exposures as well. But if you do have the ability to reach out to your, local councillor or your member of parliament or someone like that to build awareness, definitely that is something that is one great to do. So the other question, many times I get this is, oh, it's everywhere. So what difference will it make if I just reduce my personal, plastic exposure, or, I don't use plastic in the microwave to heat food, or I don't carry a plastic lunchbox, I don't give plastic lunch boxes to my children, or I don't give them plastic bottles. It's everywhere. How will I not be exposed to it? So what did they do? So 5 families, 20 people in them, for they were eating the normal regular food of packaged and everything. For 3 days they were given fresh food, which the study authors gave them. No canned, no packaged food. And what did they do? They measured urinary bisphenol A and DEHP, that is another harmful chemical called a phthalate, before and after the clean diet. And BPA and DEHP are used in food packaging. Just eating clean, and this was only for 3 days, reduced the concentrations of BPA by 66% and DEHP metabolites by 53 to 56%. That is a huge number for just a difference of in 3 days of eating clean. So my point is, don't think that because EDCs are everywhere that you cannot control your personal exposure. Yes, you can control your personal exposure. And my point is, if you are aware, then obviously you will take trouble to find out how you can reduce your exposure. 100% staying away from plastic may not always be possible, though we would love to do that, and there are a lot of alternative ways. You can figure out lots of ways to carry your own shopping bags. Don't bring the plastic bag home. And in places where recycling is available, that is another good way. Recycle. And ideally, if you can help it, don't eat packaged food and drinks in cans and things like that, processed and packaged food. That would reduce your exposure as well. So next thing is, so that is all from me. And on the 11th of July, we are going to have a free webinar on PCOS. Why is it difficult to lose weight? And these are the 2 websites. Feel free to reach out to us. And if you have any questions, you can email them to us at info@mbsprogram.com. And see you at the webinar. Bye now.